Ulabinaka, and a very good morning to you all. I want to begin by expressing my heartfelt thanks to WowSkid Fiji for inviting me to launch the 2023 Fiji Childhood Cancer Awareness Month. First and foremost, as a parent who knows well the ups and downs of bringing children, with the eternal hope that good health and opportunities for their growth, and in time, grandchildren, continues the blessed cycle of life. There are simply not enough words to express how grateful and lucky we are in Fiji to have an organization like WowSkid Fiji. And again, I want to express my gratitude for the founders and those who keep the organization going, for standing up in the gap and providing necessary bridge between our young patients and the hospitals and doctors and nurses. Not only do they help to save our young lives, but WowSkid Fiji also provides a much needed source of refuge, support, and strength to parents and families of young cancer patients. As we all know from our own experiences of ill health, there is nothing like a network of other parents and families identifying, supporting, and praying with each other during these trying times, that helps to lift the spirits that are down or trying to put on a very, very brave face. I know that this annual event honors the brave young lives that have left us way too soon, as well as the bold young survivors who battle on with chronic health challenges. It is also perhaps a time to celebrate the progress made in treatment and recovery. I feel a profound sense of humility and respect that I can be here this year to commemorate such a very personal moment. I'm certain that as parents, we can and must commit to fighting this disease, using whatever sphere of influence we may have, so that all children of Fiji, and indeed throughout the Pacific and elsewhere, can have an opportunity to live a full and wholesome life. As much as it pains me to say this, the gripping reality, I'm advised, is that 1 in 2 of these children diagnosed with cancer is most likely to die. Despite the 80% survival rate of childhood cancers in developed countries, up to 80% of cancer-stricken children in developing countries die due to lack of proper medical care and lack of information on the available resources and services provided. In Fiji, the most common childhood cancer, I'm told, is acute lymphoblastic leukemia, followed by brain tumor, which is similar to the global trend of childhood cancer. In Fiji, we sadly lose on average of 20 pediatric oncology patients each year. It is thus essential that creating awareness on childhood cancer should be everyone's responsibility. The coalition government We are convinced that refocusing our health services on public health care is critical to building better resilience in our healthcare systems. By directly tackling the non-communicable disease scourge, which is the #1 cause of premature death in our country, while we try to instill a culture of wellness and good health in Fiji. In fact, it makes economic sense to invest significantly in public health. And that is why the coalition government allocated through the Ministry of Health and Medical Services a total budget of 453.7 million, a significant increase of 58.6 million from last year. Of this budget, $8 million alone has been allocated towards the strengthening of public health services with specific approaches aimed at increasing preventive and primary health care outcomes by expanding outreach programs, expanding community engagements initiatives, improving continuum of care with enhanced quality safety standards at our health facilities. The Ministry of Health and Medical Services, through its very welcome and strategic wellness concept, will continue to advocate for and create awareness on cancer prevention and control programs. The government has also allocated a total of 655,000 for outreach and awareness programs alone in the 2023-2024 budget for various public health programs. This is an increase of about 171,500 from the last financial year. Cancer has become a global scourge affecting people of all ages. And we understand that taking the fight to fundamental impacts such as non-communicable diseases will not be easy. And it may take years to be able to measure progress, but it must move quickly. Many years have been wasted already focusing on controlling the impacts of a half-hearted manner or in a half-hearted manner rather than taking decisive steps to prevent it. Therefore, the government will continue to partner with WOW Kids Fiji through the Ministry of Health and Medical Services, pediatric oncology units at CWM Hospital and Lotoka Hospital, the Fiji Cancer Society, and the National Pediatric Oncology Committee towards combating this disease. In fact, as a philosophy, we in this government believe that working with other partners, especially non-government partners, will support effective and efficient delivery of whatever we want to do, particularly in the area of health sector. So, ladies and gentlemen, I cannot overemphasize this. The coalition government is firmly behind this important campaign, and we will do everything to support it. I understand that Fiji also receives children from other Pacific Island countries for cancer treatment in Fiji. And altogether, we are currently supporting, I'm told, 82 children whose age ranges from 5 months to 18 years old. And many of them are also dispersed geographically around Fiji. This is not an easy task. And I want to, again, on behalf of the government, on behalf of the Prime Minister, commend the work of WOW Kids Fiji and for all that you do for our children diagnosed with cancer and their families. I also want to acknowledge the support provided by Australian, New Zealand governments and their readiness to support the activities of organizations like Wow Kids Fiji. I know that the most important people whose soldiers do the heavy lifting, I want to gratefully acknowledge the children, their families, the volunteers, and the communities for their love and care for our young champions. In fact, maybe I should ask all the children to stand up, that we can all give them a round of applause. In closing, my friends, ladies and gentlemen, let me urge every one of us to continue to advocate harder and louder so that our young patients get the best healthcare support that they need. You can count on my own voice as an advocate, and you can count on the coalition government and all of us there, for that support. And it is my fervent prayer that one day soon the cure for this disease will be found. And please allow me to strongly encourage all the medical minds in Fiji to do what they can to help advance and contribute to the global research and science towards the cure. We must walk on and walk strong together. Thank you, Nava Lebu. And as I said, it's my honor and my pleasure to be here and to support the work of Wow Kids Fiji. Thank you.